So, Alec, many of you have heard my story several times, but I was asked to share as if I was sharing for the first time. So, Alec was just turning 24 when he was diagnosed in 2015. He was really sick, and we all thought that he had the flu. He took himself to urgent care and called to tell me that he was diagnosed as a type 1 diabetic. I immediately started research on WebMD and Google because surely this doctor had no clue what he was talking about. Because everything that I learned when I was in physical therapy school said type 1 is found in children. And Alec had always been healthy. So this doctor obviously did not know what he was talking about. Well, turns out I was wrong. Alec did surprisingly well adjusting to his new life. We all experienced some highs and lows within the adjustment period, no pun intended. So type 1 was definitely a learning curve. Fast forward 1.5 years to December 2016, and Alec got a promotion. He was making better money, and his new job title was general manager. It came with a nice pay raise, but no insurance and no other benefits. Alec decided that since he was making more money, that it was time to ultimately venture out on his own, and he found an apartment closer to his job, and he was excited. I was scared to death, and I asked him to find a roommate, but he insisted on living alone for the first time because he was craving freedom and independence. Fast forward to May of 2017, Alec was still 25, just getting ready to turn 26. On May 20th of 2017, Alec turned 26. Should have been a reason to celebrate, but my fears increased because he was about to become uninsured. June 1st of 2017, or D-Day, Alec officially became uninsured. June 22nd, Alec went to the pharmacy the first time to refill his prescriptions without his insurance and left empty-handed. The price he was asked to pay was $1,300, and he only had $1,000 in the bank. On June 27th of 2017, my worst nightmare came to fruition. I was at work with a home care client and received a call that Alec's body had been found on his bedroom floor. Not 5 minutes before that phone call that I got, I had actually sent Alec a text message reminding him that I was stopping by that evening to deliver a new dining room table for him. The medical examiner reports that there was no insulin in his apartment and that it had appeared that he had somehow extracted every drop of insulin that was left in his pens. Because typically we know that when you throw out that pen at the end, there's a few units left that just gets tossed out. On June 30th, that would have been Alec's next payday, and he would have had enough money on him at that time to buy his expensive ass insulin. Alec was stubborn. I believe he did not ask for help because he was trying to show us that he was responsible and he could live independently. And I'm positive that this is why he didn't ask me for money. He knew I would give it to him, but I would also have asked him to move back home so that he could afford his prescription meds. Alec loved life. He was silly, he was active, he was smart, and he had the biggest heart. Nothing meant more to him than his family and friends, and his goal had always been to make people happy. Alec loved to travel, play practical jokes, camp, hike, fish, and most of all, watch and play sports. His goal ultimately was to open his own sports bar. Since Alec's death, we have teamed up with the amazing organization T1 International. They have provided me with a platform to share Alec's story and to work on policy changes so that someday we can stop adding names to the growing list of those who have died due to the lack of access to affordable insulin. My journey, my fight, has taken me to Indianapolis on several occasions, to Boston, to Canada, to Detroit, Miami, and Washington, D.C. I've had the opportunity to work with state and federal legislators And we've been able to raise awareness of this insulin crisis that plagues the U.S. Our fight's not over. Even though we currently have legislation in place in Minnesota, Alec's law does not lower the price of insulin, and it doesn't cover all that needed. My goal is to help create legislation on the federal level that lowers the cost and benefits all. Pharma is currently suing us in Minnesota to stop our bill. We're working with a team of lawyers and the Attorney General's office to prevent this bill from being overturned. And once we achieve that, it will open up the ability for other states to implement a similar policy for emergency insulin. So I know Alec has walked beside us every step of this journey, and I know he is in a better place and helping to make magic happen. I look forward to the day that I get to heaven and I can receive my Alec hug once again. So in closing, I want to take a moment of silence to remember those that we have lost. These are only a few of the names. We know there are so many more. And I encourage you to remember these names, say them often, and help us to keep the list from growing. Thank you.
Thank you so much for sharing your story, Nicole, and for your continued advocacy. For those who don't know, in addition to Nicole's being in those different places that she named, she's also currently on 2 billboards in Indianapolis. So it's great to have that presence there, even though we can't be in person this year.
My name's Jazmine. I am a nursing student and CNA who lives in Raleigh, North Carolina, and the older sister to Jada Lewis. She passed last year, June 22nd, 2019. Jada was my absolute best friend. I talked to her about any and everything. She brought out the best in me. For instance, I absolutely hate taking pictures. And every time I would drive home to Virginia to see my family, she would insist that we take a selfie together. So the majority of the pictures in my phone that are of me, she took. She was very much into fashion. She was 6'5", so it's really hard to find clothes that fit her. So she would, just do her own thing. And so she had her own sense of style. And she really enjoyed doing that for herself as well as other people. And it really lent itself to her interest in drama. She was in several plays in school as well as in extracurricular programs. And she was just a clown. I think that's the best way to put it. She was an absolute clown, and we loved her for it. I remember back in June, my mom called me. I was at work, but I answered anyway because if she calls me while I'm at work, it's probably important. And she told me she was in an ambulance with my sister on the way to the hospital. I immediately go into, big sister / nurse mode, and I'm trying to find out everything that's been going on. Apparently she'd been sick for a few days. She was throwing up. She couldn't eat, very nauseated. She got to the hospital. They admitted her to the ICU. She was in DKA, and she stayed in the ICU for a few days before moving down to a less intense unit. I was actually with her that first weekend that she was in the ICU. And I took 3 days off of work, and I went and I stayed in the hospital with my sister. She was discharged home the following week, and she was home for about a week before she passed. I was able to talk with her about, what happened, how she ended up in the hospital at all. And she said that she hadn't taken her insulin in about 3 weeks. As a type 1 diabetic, she knew the importance of insulin, so I'm just flabbergasted as to, how has she not taken it for 3 weeks? And she told me that it would have cost her $300 to get her medication, and she didn't have it. We're kind of a proud family, so I'm not surprised that she didn't ask for help getting that medicine, but at the same time, it's really frustrating that she would have had to ask to help pay for life-saving medication. And so my sister died. She couldn't afford $300 for her medication, and so she died. And it's been over a year, and it's still having its effects on our family. We're all just still devastated, and it's hard to believe that she's not here with us anymore. And it's really painful and, again, frustrating that, like, the reason that she's not here, it's because she could not afford a medicine that she literally could not live without. So that's, while it's been difficult to have to adjust to life without my sister, I am grateful that it's brought me to this sort of just advocacy platform that I have now. Like, I found T1 International, and they've been incredibly helpful and supportive, and it's given me hope that maybe I can be part of the movement. I can help change things so that there aren't any more cases like my sister. And it's really been a blessing, and I'm grateful for that. So now here I am, more than a year later after losing my sister, and this is the second time I've spoken at a T1 event. I was at the protest outside Eli Lilly last year, and that was it was almost a surreal moment, but it was really, really powerful to be around so many people who are so passionate about this cause and genuinely want to see change. And so I'm hoping to continue that as we move forward, even in a pandemic, just to be able to speak up for people who need, that kind of support.
Thank you so much, Jazmine, for sharing your story. It's so powerful, for sharing your story of Jada. It's so powerful to hear about Jada and about Alec and about the stories of all the folks that we've lost. And it's our goal with all of our advocacy to move forward so that this never happens again. You sharing your stories, helps us move ever closer to that goal, because it's so striking for people to hear about the fact that this happens here in the United States. So one of the first ones I wanted to ask is, what gives you strength when you are tired? Jazmine, we can start with you.
So I have, I don't want to call it like a shrine, but there's a table that I have in my house, and in the middle of it is a picture of my sister. I have her obituary there. I have all sorts of cards that people have sent me. Some things that she liked, a lot of pink things, because that's her favorite color. And if I'm having a tough time, which is pretty often because I'm in nursing school, I look over at that table and I see her and she's smiling at me. And that lets me know that I'm going to be all right, because even though she's not here, she's here.
Yeah, definitely. Nicole, what about you?
I think what gives me strength is, hearing other people's stories, knowing that Alec was not alone in this craziness, that his struggle was not just his struggle, that people everywhere are encountering the same issues, and knowing that, we want this list to stop growing. We don't want to keep adding names. I don't want to keep hearing the horrible outcomes of having to ration insulin. So I think that's what ultimately gives me strength, is hearing that, the fight needs to go on.
Yeah, certainly. What has been the hardest part of sharing your stories?
The hardest part, I guess it's twofold. One's talking about my sister in the past tense. I don't think I'm ever going to really get used to that, but it's a fact. She is no longer here, so she's like, it's a was. And then also, even though I tell people, I'll talk about Jada left and right for hours on end. But the fact that she's like, it's not an isolated incident like that. It's all too common for these stories to exist, and that it's mind blowing.
Yeah, definitely is. Nicole?
Yeah, I think the hardest part for me has been, I'm a very introverted person, so finding my voice and finding the platform to share my story, but then hearing all the negative feedback at times, hearing comments that I'm ultimately responsible for my son's death, that I should be in prison, that I'm selfish, that I'm a bad mom. A lot of the negative things that I've heard from both inside and outside the diabetic community at times have shaken me. But I know that, the negative comments are far few in between. That the positive stuff that we're doing outweighs that.
Yeah. And you have to know the entire diabetic community, all the questions and answers that we've gotten so far are actually words of encouragement, because we all feel so strongly, and we all are so appreciative of the fact that you raise your voices and that you talk about this, and over and over, that you keep talking about this. It means so much to the community. What's one moment or experience that has made your advocacy journey worth it?
I'll say right at the end of the protest outside Eli Lilly last year, a woman came up to me, and I had no idea who this woman was, but she said, I'm sorry you lost your best friend. Can I give you a hug? And we hugged for like a solid 5 minutes. And that let me know that people genuinely care. And if this one woman, this one stranger in the middle of Indianapolis, where I live hours from there, is willing to show me that kind of love and support, then there's got to be more. And there have been plenty of other times like that. But I think that first time a stranger came up to me and said, I see you, I hear you, I love you. Thank you for what for sharing. And that's kind of been like that lit a fire under me. And it's made this a very, very rewarding experience.
Yeah. Nicole?
Yeah, I think for me would probably be finally passing the Alec Smith Emergency Insulin Act. Finally getting, a one-of-a-kind bill signed into legislation. I think that that was probably, the highlight so far.
Yeah, that was a big moment. And I know, the photo from that day, the photos from that day, those were very, very powerful photos. And I know we were all rooting for you as that was getting passed. What do you want people to know most about Alec and Jada?
Jada lived in the moment all the time. And I think that's a valuable lesson to learn, because obviously life is not very long. She only had 24 years of it. But I think she made the most of it. I really think she did. And that's something that I've tried to incorporate into my own life, which is hard at times, but it's that was her. That was her.
Yeah, I think I want people to know how kind Alec was. He was one of the most kind and sensitive and loving people that I've had the pleasure of meeting. and he gave the most amazing hugs.
It's always nice when you find someone who gives those sorts of good hugs that really you can feel it to your core. So I know how important that can be. One of the audience questions: their 22-year-old daughter does not easily discuss her type 1 diabetes. Would you advise them to push those hard conversations and try to make them more common in light of your losses and your hindsight?
Yeah, absolutely. I think, you know, they're not easy conversations. I think Alec really felt isolated because he knew nobody else who was a type 1 diabetic. He had no resources to lean on. He had, no role model to model his behavior or his disease with. But I think if we would have done a little more research, we would have found, there's actually a lot of people, even in our own community, who I have found since he passed away, who are type 1s that, people just keep it so quiet that you just don't even know that your neighbor, and we found out my neighbor is a type 1 diabetic. I mean, and they used to work together, Alec used to help him with his yard work or, do different things around the house, and he never knew. Neither one of them knew that they were each other, either one of them were a type 1 diabetic. I mean, that would have been a huge plus for Alec, somebody to talk to. And those conversations are hard, but you need to have them, especially when when it's moving towards, her being independent and getting her own insurance and the cost, and those type of conversations should probably start now.
Yeah. Jazmine, what do you think?
Well, I don't have any kids, but I think speaking from the child standpoint, it's always going to be kind of awkward talking about anything like that with, especially with a parent. But I think as long as you have that relationship of trust, just mutual trust and respect, that like you're going to have that conversation, but it'll become less maybe embarrassing or awkward or just uncomfortable once you finally break the ice there.
Yeah, definitely. So what are some of the challenges that you've faced as an advocate?
I think, so I mentioned I'm in nursing school. People listen to you a little more when you got a couple letters behind your name. So those letters I'm reaching for are RN. So when as a student, when I try to speak about things, people kind of write you off. And so that, I guess that's just coming from like a healthcare perspective and working in healthcare like that. But otherwise, folks are pretty willing to listen to what I have to say and appreciate that I'm saying it. But definitely from being in a healthcare standpoint, just it's a little bit less respect for students as opposed to the registered.
Yeah.
Yeah, I think, dealing with all of the misconceptions that are out there around diabetes, having to first focus on education and educating, the general public. And even I have encountered having to educate healthcare professionals on the difference between type 1 and type 2. And type 2 is absolutely, involved in this conversation. But when we're talking about, specifics, trying to get that stigma out of people's, minds over, how somebody develops diabetes. It's very, very frustrating. So I think that's been the hardest part, is having to to go so deep into education versus, just, demanding affordable insulin.
Yeah, definitely. So I will end with, what is your hope for the future? Jazmine, we can start with you.
I don't want anyone to ever feel how I felt when my sister died. I don't want anyone to have to experience that again. So I really want the United States to get on board with what seems like a large part of the world has figured out, that healthcare shouldn't have to cost people thousands of dollars a month. It shouldn't be a decision to pay your rent or go see the doctor about the fact that you've been throwing up for 3 days. That's not a decision that anybody should ever have to make. And I don't want that to happen ever again.
Certainly. Nicole, what about you?
Right along the lines of what Jazmine said, healthcare reform. We shouldn't be living in a society of for-profit healthcare. So hopefully, we will be able to, I think that we'll be stronger as an advocate group if we can, raise our voices and unite with others and, create this huge movement where our entire healthcare system is reformed from the top to the bottom.
Yeah, definitely. And you both have been such a help with moving us in that direction. Your continued advocacy is so very powerful and makes such a huge difference. And the community really can't thank you enough for all that you do.